Hi there, and welcome to another episode of Health with Dr. Yvette Masaka. This is a podcast that aims to correct myths around health. So today we're going to be talking about living with epilepsy. I'm sure most of you have heard about epilepsy. So what is epilepsy? Now, the World Health Organization defines epilepsy as a non-communicable neurological condition that is associated with seizures. So for you to qualify as having epilepsy, you have to have 2 unprovoked seizures 24 hours apart. But if you want to go deeper, epilepsy can be defined as having 1 unprovoked seizure with the chance of having another seizure. So today we have Hope Simkuka to take us through her journey with epilepsy. Hi, Hope.
Hi.
Thank you for joining us today.
Thank you.
So tell us, Hope, how were you diagnosed with epilepsy and how did you find out you have epilepsy?
How did I find out? Wow. Okay. That's a long story. Yeah, but I'll try to cut it short. So my first seizure was when I was 1 month old. It was due to a high fever. And so they just sent my parents back home. And then when I was 1 year old, I started having seizures, like as many as 20 to 24 in a day. Yeah.
That's
that's when I was diagnosed with epilepsy, but I didn't know. Yeah. I only found out when I was 17 years old.
Wow.
Yeah.
How did you take it? And how did you find out?
Well, I found out because I was in boarding school and I really had a really bad altercation with a friend. So I think the anger must have been the trigger. So I wake up in the school dispensary and I'm told you had a seizure. And the first thing that came to my mind was like, oh, so does it mean I'm possessed? Do I have demons? Because that's the only thing I heard about the condition back then. And when the nurse told me, I was really in shock. I didn't really take it well. I cried the entire night that time. And, well, she encouraged me and she said, oh, maybe it's your first time, so it won't happen again. It was just because of something. But then when mom and dad came to pick me up from school in Ndola and brought me back to Lusaka, we came to UTH. And I had another episode, so they brought me to High Coast. And while in the doctor's office, the doctor was like, oh, no, let me talk to your parents and blah, blah, blah. But the mistake they made was that they left the file with me.
Oh, no.
Yeah. And I was on a wheelchair, I remember really well. So the file was just on my lap. And I was in the
and
the
you
hallway.
could read.
And I was really curious because I was just like, when did I start having this and so on? So I started reading and I was like, I've been epileptic since childhood. I was like, what? I really didn't believe it. Oh, I screamed. I was angry at my parents for hiding it from me. I was angry because I thought my life was over. I was devastated. I was depressed. I was in shock such that it sent me into another episode. Yeah.
So at this point, you were not on any medications?
No, I wasn't. Yeah, because I had, when I was 1, after I started having the seizures, and then I had these small little breaks of maybe 2 days without having seizures, and then till when I was about 5, when my dad's friend suggested that they should take me to a Chinese clinic, and then I started taking the medicine. So the seizures did reduce drastically to a point of being seizure free, and I think I stopped when I was somewhere like grade 7. Yeah.
Okay.
So I stayed for about like 5 years without having any seizures because I started again in grade 12 when I was in boarding school.
Okay.
So I really had no idea. And then when I was taking the medicine from the Chinese clinic when I was young, I was told, no, it's just because of the headaches, because back then I was having really bad migraine headaches. Yeah. So I stopped when I was in grade 7, and I thought, oh,
So from grade
everything's good.
7 to grade 12, in between, you didn't have any.
No, I didn't, and I wasn't on any medicine.
Okay, so do you think if your parents told you earlier, do you think you'd have taken the news a little better, or you would have known, or how do you think it would have changed your reaction?
I don't know, because I think still at first instance, whenever the time, I would still have been in shock. I would still have had trouble accepting it, I think, because the only thing I heard about the condition were about demons and witchcraft, and nothing good about it. Nothing like, oh, it's not transmissible to another person. But all I heard was that no, another person, if they're standing near you, if you fart and they smell your fart, and then they're also going to get it, and all those stories. So I was really ignorant about the condition. I knew nothing about it. So I don't know. Maybe it was best that time when I found out, because then I was able to read about it on my own
more, yes.
and understand, and so on.
So, considering that you thought that you had demons, did you go for any prayers?
Of course. I have lost count on the number of pastors I've seen in my life. Yeah. And of course, they will be like, oh, it's just witchcraft. Someone has bewitched you, maybe a relative in your village or something. And because I come from Western Province, of course, they'll be like, oh, a witch from the Zambezi River. And stuff like that. So it was so convincing, because when I had my seizure, the first one when I was 1 year old, I was at my grandma's funeral. So everyone was like, oh, the spirit for the grandmother has entered the child, and Shanshani and stuff like that. So it was believable. Well, to my parents and to the family, it was believable, such that and I had an aunt in the village, may her soul rest in peace, and the pastors always asked, do you have a relative in the village and stuff like that? And I'm like, oh yes, oh, that's a relative, she's the one who is doing this. And so it brought a rift between my aunt and my mom, like to a point of no communication for a long period of time, because she was upset to say, oh, how can my own sister do this to
my child? Yeah,
exactly. So I think the pastors really almost broke the relationship between my aunt and my mom.
I see.
I've lost count on the number of pastors I've seen, to be honest.
I can imagine.
Sometimes I would even have seizures when I go for the prayers, because I can't stand loud noises like drums and stuff like that. And usually when they're praying or something, or they're preaching, when the sermon reads Palia Palasti, they'll beat the drums and stuff like that. So I would always find myself having seizures, and the pastor would be like, yes, it's because the demon is scared because we're in church. Oh, nigga. Yeah, so it was really, oh my God. It was really draining, especially because sometimes you would believe that, oh yes, I went for deliverance and they prayed for me and I'm fine now. And then next thing, maybe you would even stay a considerable amount of time, like maybe a month or some weeks, seizure free, and you're like, oh yes, it worked. And then all of a sudden, again. And it was just sending me in this depression. Like, then I started to feel like God wasn't answering my prayers. I started to feel like I was alone, even if I had a really good support system, but still, I just felt like I was carrying the weight of the world on my shoulders. The pastors, they didn't do anything good for me, for real, because they did a lot of damage to my family, to me, even to my mother who trusted them, because she always believed when I was seizure free after prayers that, it was,
Yeah.
that kind of thing. But then I would get sick again, and she'll call them to say, but my daughter got sick, blah, 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 blah. And they'll be like, no, God, do what? No, you're not a man of God. She'll shout at them, you are a liar. Oh, blah, blah, blah. And this thing of sow a seed, and should give them a lot of money. Because, well, probably in her own accord, she felt like maybe if she helps the church, or you just know these things sometimes. So, they ate a lot of our money, Mandy. Oh my God. We lost millions. Yeah, so I've been to pastors. I've even been to witch doctors. Not just any witch doctor that tells you, or herbalist, that no, drink this medicine. No, those who even do what do they call those, incantations, or with chickens and whatnot. I've been through it, yo.
No, you've been through it.
I've been through it. Nakapitam. In fact, at that point in my life, I was going through a lot. No, let me rephrase the statement. A lot was going through me instead. Yeah, so it was very bad still. I just decided to say, okay, no more pastors, no more witch doctors, no more herbalists, no more traditional healers. And I think from that time, I've had a lot of peace, because I think that's the point when acceptance came in, to say, okay, fine, what do I do to make my life better? How do I avoid my triggers to better my quality of life, Because then I wanted to go to school, I wanted to start uni, and there was the studying and the adjusting, and it was hard. So I had to put myself together so that I put my life together. Otherwise, I wouldn't have been able to go to school. And my dad honestly didn't believe in the whole pastor thing and whatever, or herbalist and whatever. He just said, he just told my mom, if you ever take my daughter to that shit again, it won't be nice. So mom used to do it low-key sometimes, like she'd just go herself without taking me. Like she'd go for the prayers,
standing in the gap,
like standing in the gap and whatnot, and I'll be at home, and sometimes I'll be like, oh, okay, I'll go with you. When the day arrives, I'm just like, I'm not going, bruh. Forget about it. And she would go alone. Sometimes she would go even with my sister. Yeah, because in the beginning, I never wanted to go, but I used to go because I felt bad, felt guilty, sort of. Like, if I say I don't want to go, but how will my mom feel? She's putting in so much effort, to see me better. And I just wanted to appreciate her efforts. But in the end, it became frustrating even for me. So then I stopped going. And when I talked to Dad about it, he said, it's okay, you don't have to go. So he talked to Mom, and yeah. Eventually, she also stopped going, because I think she eventually saw right through them, because they were saying the same thing. And sometimes they'll be like, no, your brother, nigga, my brother died. So like, it was just, they told us stories.
Yeah, I can imagine. I know you said that you felt alone, but interestingly, in the world we have about 50 million people who are living with epilepsy.
Yeah,
that's a lot of people. And another interesting thing is that most of these people are in middle to low income countries.
That's true.
Yeah, so according to the World Health Organization, they say that we have, basically they're saying our health systems are poor. So we have more of these things that predispose someone to having epilepsy. Of course, 50% of people who have epilepsy, we don't know why they have epilepsy. Then 50% they have some underlying condition. Some have brain tumors. Some have head injuries. Some have strokes. And for babies, it's usually injury to the brain, either by not receiving enough oxygen or by some form of trauma. So is there anything that predisposed you to having epilepsy?
Yes. I didn't cry immediately after birth. I think it took a little bit of time, like some minutes though, not very long, because they had to shake me, turn me upside down, that thing.
Hit you a little bit.
Bad. Yeah, and then I finally cried. And then I think there's also a genetic component, because on my mom's side, like my cousins, some of them have epilepsy. Yeah. So I think it was
a combination
of both.
Of both. Yeah. Did epilepsy ever affect you in school, in terms of school performance? I know that there are parents out there watching, and maybe their children have just been diagnosed with epilepsy, and they're wondering, like, will my child perform as well as other kids, or will epilepsy affect them?
Well, not exactly. Why I'm saying not exactly is that, of course, I would miss classes sometimes. Like, I wouldn't study as much. So I think that also kind of reduced my performance. Wasn't as good as it should be, but I was basically like every other student. I had my good days where I would pass and do well and like do really well. And then there were those times, Unza, like my first physics test, I got a 37%. I didn't sleep.
Well, that's okay. I got a 33%.
Well, yeah, that's why I was saying.
I don't know if anyone ever passes that physics, but no, I passed the rest.
Yeah. Yeah, so even me, it was I think that was my weakest link.
Yeah, that was like a wake up call for everyone.
Yeah. So I was just like, oh, damn, this shit is really hard. It was what woke me up to the reality of natural sciences.
Yeah.
Yeah. But then sometimes I felt out of place, because sometimes I used to have episodes like in the lecture theater when we're having lectures, and you just know how big NSLT is and all those people. And then now I find myself on the floor and other people are just running around. Sometimes I would even find other students, maybe those people who go for my scripture, and they're praying for me, and I'm like, oh, sorry.
Like,
when
my
I
bad.
remember those things, it seems like I watched it in a movie. Like, I can't believe like I actually went through all that stuff. So it kind of affected me, like even, yeah. But school-wise,
you performed well.
I performed well. I've always been brilliant. Not to brag.
Well,
Yeah.
yeah. I was one of those people who were running away from people having seizures.
Yeah.
I remember in grade 3. There's this girl who used to have seizures. So, well, now I know they're seizures. When I was young, I didn't know what they were. All I know is that I would run away and the teacher would like carry her. But every time she does something silly, we'd always tell her that, like you swallowed a cockroach at home. So, so when you start doing that, the cockroach wants to come out.
Wow. Wow.
Well, I don't know why kids are mean.
Yeah,
At that
very
age, I
mean.
don't know how we thought of that, but we always used to tell her that she swallowed a cockroach, and it was like that big flying cockroach that was trying to come out of her.
Oh.
Yeah, so
Well,
I really
that's-
felt bad. She used to get so mad. She used to cry.
Yeah.
Yeah,
Yeah.
and those.
I'll cut you some slack.
Yeah,
because you were
I
just
was
a
young.
kid.
Then there was another girl in secondary school who was having a seizure. So I only found my friends running away from her. And I also just started running.
You didn't
Because
know
they
what
were
you
saying,
running from?
I didn't know what I was running away from. But because people were saying that if someone is having an episode like that, it means that the demons are coming out. And the demons will enter whoever is close by, especially if they're not, strong spiritually. Like, yeah. So I was like, that's not
I
me.
can't
I'm not
take a
strong. I'm not strong. So I would run away. But
Yeah.
now that I'm in this profession, now I'm the one who runs towards the seizures. Like someone is having a seizure and I'm there running to see, what I can do.
Yeah.
Yeah. But I hope people around you are learning about epilepsy, like they have the correct information now. Like your family, have they?
Yeah. Okay. Well, my dad and my siblings, I think they have accepted and that reached that level of acceptance. Like, okay, so this is the way it's going to be. But my mom, let's see, maybe about 70% acceptance, 30%. There's still that little part of her that wishes, like, of course, I understand her, but sometimes when I'm seizure free for a long time, and she even keeps a record, like in her diary and stuff like that, and she'll be like, "Oh, today I 1 month seizure free, today 3 months seizure free," like that.
That's cute.
Yeah, she always reminds me, "Oh, today I 6 months seizure free. Today it's 1 year," you know. Yeah, and sometimes when I'll be like, I don't feel good, I have auras, I need to sleep, and she'll be like, "No, it can't come back in the name of Jesus." And I'm like, "Yo, we're still on that." You know? Yeah, so I think, I don't know.
But I think everyone needs something to hold on to.
Yeah.
So for her, it's the prayer. It's God. I think everyone needs.
I think so. Everyone needs some sort of a lifeline after all.
So that's her lifeline.
Exactly. So I understand her. So I just don't know if she has really accepted it. I don't think she's reached like 100%, like I said. I think she's in 70-75%.
But that's good enough.
It's good enough, yeah, at least.
Yeah. So how long did it take for you to actually know your auras? Yeah, so auras is like basically something that someone feels before they have a seizure. So how long did it take for you to actually know that, okay, this is a seizure coming?
Oh, it took some time but I think what made it easy was the frequency of the seizures. They were very frequent. I would have a seizure almost every day, or not a seizures almost every day. So I started to pick up on the auras, especially the ones that come in before a seizure, like 2-3 minutes before a seizure. I started picking up those. Then as time went by, then I started picking up the ones that say, "Oh, if you don't take care of yourself in 1-2 days, you're in danger. Yeah, don't do this and don't do that." And so because I started picking up the ones that occur before a seizure, is there anything like immediately before? I don't know. But yeah,
but I get what you mean.
you get my point, don't you? Yeah. So because I picked up on those, if I'm standing, I would sit. If there's a place where there's a chair, if I'm somewhere safe, like maybe in the house or something, I would sleep on the floor. Like even at work, lock myself in a cubicle. Okay, not lock, but just close the door sometimes. Leave a tiny space, like in case of any you know? Yeah. And then just sleep on the floor. And then,
So do people at work know about your condition?
yeah, literally everyone in the department
Wait.
knows that I have epilepsy. And I think even some of my patients, well, I've become quite open about it.
Yeah.
Yeah, because I found that sometimes I can use it to help my patients get through what they're going through sometimes. Sometimes when you tell a patient, like, oh, no, so and so, sometimes, oh, you'll be fine, whatever, they'll usually be like, but you don't even understand it. You're just a professional. I don't know if you've ever experienced that.
Yeah.
Yeah. It'll be like, if you don't understand, you're not going through it. You've just gone to school for these things. And I'll be like, oh, no, I actually have a chronic condition. And it's like, so. And they'll be like, what? You know? Sort of gives them some, some hope.
Yeah. Like
Yeah, to say, oh, if this person has a chronic condition, but they're like this, and they're living a normal life, what of me?
Yeah.
I think I can do something like that. So, yeah, there's that. It's a lot.
I'm sure people are wondering, like, what does she do when she sees patients?
Oh, yeah. Yeah. Well, I'm a physiotherapist. Yeah. I went to uni at UNZA. I got my degree. Then I just graduated with my master's. That was like 2 weeks ago.
Yes.
Yes.
Yes. Congratulations.
Thank you.
You see that? And all those that say that epilepsy affects knowledge. There are all those misconceptions about it. And
Yeah.
here's your evidence.
Evidence. It's evidence-based.
Evidence-based study right here. She made it through NS. Natural Sciences. I'm sure UNZA students know what you went through.
Oh yeah, ish.
Yeah.
It was really something. But I think, I don't know, I think this condition has a good side to it. I think I would be a whole different person without it, without the condition. I think I would view life differently. I think I would have had different perspectives when it comes to certain things. I think I would view life ordinarily, like just like, in passing, without that deep, yeah, I think I would be a very different person. And I don't know I don't know if I should say that I'm actually glad I have it, or I don't know, because
your mom shouldn't hear you.
oh, of course, yeah, but I feel like it has shaped me into the person I am.
It's made you a better person.
It's made me a better person, because back then, of course, I was really like a mean teenager, before I discovered. Yeah, but I think
So you're saying epilepsy humbled you?
Oh, it humbled me. It did. Because back then I was just like, so someone then has seizures, has got demons. Hey, whatever. I just had really, these myths. I think they really need to be debunked, because there are a lot.
Yeah, because epilepsy, first thing that comes to mind, demons.
Demons, and also that it's contagious. It's not contagious. Imagine the amount of people who have come into contact with the have or had seizures.
That's true. What funny experiences have you had while you're having a seizure? Or what have you been told? What funny things have people tried, apart from the prayers that you mentioned?
Well, apart from that, I've seen people put a shoe over my mouth and my nose. Yeah.
So, wait, you're supposed to smell inside the shoe?
Yes, and apparently when you breathe the air from your shoe, apparently, I don't know what it does to your brain or whatever. I don't understand the science behind it. But you stop. But then that's not really that when you smell the shoe. Of course, the seizure comes to a halt at a certain point. So I think maybe when they put it over your mouth and your nose, and then you stop seizing, the time that when the seizure decides to abort on its own, then they're like, no, it's because of the shoe that we have put. You get, yeah,
I can't even imagine it.
yeah,
Like coming out of a seizure and you're like, guys, like,
yeah. And then like,
what's this on my face?
I've experienced that not just at home. I think someone told my mom, like even on the street, I find a show over me and I'm, what happened? Yeah. No, bakambati ukanoshacha pensapato yako nishikwasila siviza bwela pofuti. Oh, that's a first. Just I think 3 days ago, my friend who's also living with epilepsy told me that someone told him that if a guy is having a seizure, they should make him wear a bra. He'll stop having seizures. And so I don't know if that applies to women also. Maybe they need to be,
Maybe you wear a boxer.
maybe, or a tie or a belt. I have no idea. But just by virtue of a bra being a lady's garment, as long as he wears something that a woman wears, yeah, that he'll stop having seizures. And I was like, that's the first.
Did your friend try?
I actually told him that maybe you should try. We best start laughing.
Well, I mean, what's the harm?
I mean, I was just like, oh.
So it can be a new bra.
No, it can be for someone who has one before. I think maybe someone close to you. So I was like, you should just tell your girlfriend to make you wear a bra one of these days when you're having a seizure.
Oh.
It's crazy.
Has epilepsy ever affected your dating life, or does it affect other people's dating lives?
For some, yes. For others, no. But I feel like the yes affects women a lot. Like, I don't know. I don't know if it's because women are so nurturing. So sometimes even if you love someone and then they tell you they have a chronic condition or whatever, you'd think twice about it kuma first. But as time goes by, like, you would be willing to take a shot.
Yeah.
Yeah, you'll be like, yeah, maybe. Maybe it's not so bad. Let me just read about it. Let me just, But for women, find someone who just be like, no, I can't date someone. Like for me, I was told that I can't date a girl who falls. Yeah, I can't be with a woman who falls. Oh, okay. Yeah. I've lost many talking stages, as we call them. Many talking stages because I have seizures. So at some point, I even used to hide. I used to wait for just the guy to fall for me for real. Then I'll be like, I'm like this. It didn't work still. Those who wanted to leave still left. And so I'm someone who's had a lot of talking stages because a lot of them have failed because people have found out that I have seizures. Yeah. It's really sad sometimes, like you really like someone or you actually love someone and then they just say, no. Sometimes they wouldn't really outrightly, like directly tell you, it's because of this. But you just notice when you tell them, a change in attitude, they stop picking your calls, they don't call, they don't text anymore, they don't. And then you find yourself just forcing things. And then when you put the puzzle together, you're like, yeah, okay. It's because of this. But then also those good ones who also stay, but life happened and just didn't work out. Not because I have epilepsy, but just because of other things. So
yes and no. It has.
So yes and no.
Yeah.
At first, actually, when I saw that a lot of talking stages were failing, I even said that maybe I should just stick to health professionals for now. Because I thought that maybe they're the ones who are going to understand. But
Same.
Same. I thought because they are more learned about these things,
that they'll be more accepting.
But I don't know, maybe because they know the dangers. the disadvantages or whatever I can call them. And they'll be like, no, Shani. Oh, yeah, like that.
Have you had any severe side effects from taking your anti-epileptic drugs? Because few people complain about feeling that they're slow, like they're having slow mentations, they can't process things very fast, they feel drowsy, very sleepy, all those things. Have you experienced that with your drugs?
Yeah, the drowsiness and the sedative effects of the carbamazepine do get the better of me some days. Sometimes I can't afford to not keep active. Otherwise, wherever I am, I'm going to doze. Yeah, I must keep my brain engaged, not idle. So even if I'm seated, I'm on my phone, I'm doing something, just something to just keep me busy. Watch TV, read, anything. Yeah, because if I'm too idle, then I just, become like a zombie like that. And then the other side effect I've seen, I forget people's faces a lot. Like, I would have met you like maybe, I don't know how many times this week, or you've even told me your name or whatever, but when I see you again, I'll be like, you look familiar. There was a time a student was doing attachments in my department, and then she stayed like for a week without coming to the hospital because I think she had some personal issues. So then she came to the department and she was like, oh, Madam, how are you? Now, I was curious because of the chimuela. Too much chimuela. Oh, hi, how are you? Do I know you from somewhere? Yeah. She was like, you forgotten me. I was just like, I think I've seen you somewhere. No, my name is Shani. I was even here last week. I was doing attachment. Really? That's the first point when I knew that, okay, the forgetting people is just, it's really too much. And it gets to me sometimes. Sometimes someone would remember you and you don't remember them. And not just someone you've seen once, but someone you see over and over again. Like, even like at work, in the hospital. You meet this person every day on the ward or whatever. But when you meet them on a day when I'm not too good, I forget their names or something. Yeah, it happens to me a lot. That. And then I don't think I'm slow. I'm rather fast. My brain is in, what can I say?
Like what? Hyperdrive or something like that?
Hyper overdrive. It's almost like it's got the speed of a rocket and then I've got the brakes of a bicycle. So I can't really stop it, Like it's in overdrive all the time. Like sometimes I feel myself having pressure of speech. I talk and talk and talk and talk. Like now, I just feel like I want to talk and talk and talk and talk. So even when there's a meeting or they say, no, Hope, present something, I just, you don't know what you're doing, bruh. Because I'll just talk and talk and talk and talk. Yeah. I can multitask. What can I say? I can do several things at the same time. I can watch TV. I can study. I can listen to music. And I can do something else.
At the same time.
Around the house at the same time. So even my dad would be like, but you're even watching this. Are you sure you're watching? I'm like, yeah, I'm watching. What happened? And I'll say everything. And be like, what are you reading on your laptop? I'm reading an article about so and so and so. He'll be like, okay. Tell me what you read about the article. He even gets my piece. And I say, oh, no, there it says. And he'll be like, but how do you manage? I also don't know, bruh. So it's like it's just constantly in overdrive. Sometimes I even fail to sleep because I feel like my brain is just constantly active. So I have insomnia. Yeah. Not even the carbamazepine can keep me asleep sometimes. It doesn't knock me out anymore.
Wow. What does it definitely sounds like there's something else on top of on top of the epilepsy.
Yeah, there is. But since we're talking about the epilepsy
Yeah.
now,
So just
we'll keep it at that.
yeah.
Yeah.
Okay, that's very interesting to know. What encouragement would you give to parents who have children with epilepsy or people with epilepsy themselves who still haven't reached that acceptance?
I think it's good if you talk to someone who you can trust. Just open up to someone. If you can, go for therapy. Like, if you're in Lusaka, go to UTH Clinic 6, go to Chainama, go to Levy. You can speak to a therapist, and then I think they can help you put your thoughts together and help you accept what you're going through. It's not the end of the world. You can live a normal life. You can date. You can get married. Don't be discouraged by what I said. That, oh no, I have failed talking stages. I mean, we all have different paths, but you can live a normal life. You can get married. You can have children, normal children, by the way. Don't think that, no, because of the drugs, so and so. No, just take your folic acid, go for antenatal, and you're good to go. Take your medicines on time. You'll be fine. If it, you can live a normal life. You can go to school. You can do anything you set your mind to. Yeah. There's always something you can do. There's always something. If you feel like you have problems, like when it comes to school, study, find a skill. Find something you enjoy doing and go for it. Well, some people say that school is not everything. You don't have to sit in a class, get a paper for you to be considered intelligent, for you to be able to settle into the society.
Yeah.
Don't always want to fulfill society's norms, otherwise you're going to be depressed. Yeah. So you can do this. I did it after all. Yeah. So you can. To the parents, I think just be a good support system to your children. They really need you because you're the people they need. If you are depressed and feel like it's the end of the world, they begin to feel like a burden to say, oh, so I'm just here, I'm just bothering these people. I'm saying this because I have felt like that many times to my family. Like when I see them very sad, I see them feeling hopeless, helpless. I felt like I was being a burden to them. But their feelings are valid still. But I'm just saying that you have to help these people, help your people go through what they're going through the stage of acceptance, because they really need you. Same to friends, same to spouses, boyfriends, girlfriends, husbands, and wives. Just do the same and they'll be okay. Yeah, they'll be okay. I promise you that. You should trust me. Yeah. And if you have someone who's having seizures, don't lock the person in the house. Don't keep it to yourself. You can prevent a lot of damage. I've seen people who have been just isolated from friends, from family, from workmates, school, and so on, because they are having seizures, and they're just having the seizures and they're not on medicine, any medication, they're not going to the hospital. And because the seizures are so bad, they have more brain damage. The damage to the brain is too much, and the brain, by the way, it doesn't regenerate. Like once it starts to die, then that's it. Once a cell dies, it's dead. It's not like the other parts of the body, like your skin and so on, that can regenerate. The brain doesn't. So you should prevent further brain damage in these people so that they can live normal lives and do something that, that can fulfill them, that they feel like they found their purpose, so they can live a life that is content.
Mm-hmm.
Yeah. Stay away from alcohol. Stay away from drugs. Stay away from fizzy drinks if you can. For some, it's a trigger. Just the main thing is that if you know your triggers, you're going to be fine. Yeah, because you know how to avoid the seizures. You know how to take care of yourself. You know what to avoid. Yeah. So, like for me, I don't like loud noises and stuff, especially if they're unexpected. So at home, nobody is allowed to drop anything. Yeah, anything. Because, say, especially the sound that comes with dropping the lid of the pot. Oh, that one is like instant.
Yeah.
Yeah. So if you know your triggers, you also help the people around you to take care of you.
Yeah.
Yeah, indirectly, because they know what they need to do to prevent you from going into episodes or from having more episodes.
That's a very important point. So I did have a grandpa who had epilepsy. So I think he knew his trigger. His trigger for me, what I think was either fire or smoke. So he first burnt his hand when he was young. He bent it. He was in a hut. Then he had a seizure, but he was alone. So those thatched houses.
Yeah.
So that caught fire. He bent his arm.
Oh.
Yeah. Then later on, he went camping with his friends. I think they were fishing or hunting, and they were in sleeping bags. So they had firewood in the middle, and he had a seizure. So his sleeping bag caught fire. Yeah.
Wow.
So it caught fire and it burnt him like legs up to the waist. He had very bad burns. So they referred him to UTH Lusaka, but he still didn't make it. So knowing your triggers is very important because it prevents a lot of injuries. Some people with epilepsy suffer a lot of injuries, fractures and things like that because, of the trauma of falling.
Yeah.
So you get to have all those injuries. So, yeah, that one is a very, very valid point.
And also know your auras. Make sure you study yourself so that you know what you feel or what you hear or what you see before you have a seizure. So that if you are standing, you can sit or you can lay down somewhere, or you can inform the person nearest to you to say, oh, this is about to happen, please. Just look after me for like 3 minutes. I'll be right up. Yeah, so for me, like, I know that just before my seizures, I, at least maybe, let's say 30 seconds, maybe I'll start seeing flashing lights. Like, of all sorts of colors, like blue, red. And I'm like, but there are no flashing lights here. That's that's the first thing I noticed. I'm not in a club where there's strobe lights or whatever. I'm not watching TV. But still, I'd see these flashing lights of all sorts of colors. And I'm like, it's coming. Yeah. And then I would feel, what can I say? A crawling sensation over my brain or my head. I would feel like there are a lot of ants, a lot of them. They're just crawling. And you know how uncomfortable it is to just one ant over. Yeah. Now I feel like it's all over the place. If it's not that, I'll feel like they got a bucket of ice, poured it all over my head, and like my head is like in a freezer. It's like cold, really cold. Then I know that, okay, I think 5 seconds. If I don't do something,
Nishkwasila.
Nishkwasila. Almost instantly, I'm going to fall if I'm standing. Yeah. And what happens, I don't know how it happens, but I can literally feel myself like, oh, I'm going down. And I think maybe before I hit the ground, that's when I just completely lose consciousness, like just cut. But when I'm like falling, I'm even seeing myself in slow motion when I'm saying this. Yeah, when I'm like falling, I can feel myself like, oh, okay, I'm going. And I think at a certain point, I just lose consciousness. So if you just know your auras, you'd be able to prevent a lot of injuries.
Yeah.
You'd be able to go to safety, and you'd be able to put yourself in a safe place or something like that. It's really, really helpful knowing your auras and your triggers.
And the different types of seizures, I think that's another thing that people should know. It's not just, like jerking of
Oh, yeah.
of arms and jerking of the legs. Even like blinking, someone can just be blinking but they're having a seizure.
Yeah.
They can be smacking their lips, like
Yeah.
like a baby is sucking. Yeah, that could also be a seizure. It can just be, like twitching of the wrist. That can be a seizure. So there are different types of seizures. Someone would just look like they're staring into an abyss. That could also be a seizure. So if you've noticed that your child is doing any of these things, or even an adult, and by the way, epilepsy is not just for children. It can be diagnosed at any age. Of course, we hear about it more often in children, but it can be diagnosed at any age. So if you notice any of these things, just take them to the health facility. They may have epilepsy or any other seizure disorder. Yeah.
People just know about the generalized tonic-clonic seizures.
Yeah, where everything is just
you fall to the ground, you're foaming and stuff like that. So sometimes I think it takes a really attentive parent to even come to the hospital to say, no, mwana wanga menso yanke yamaenda so, or something. It takes a really attentive parent.
Yeah. And not only parents have a role to play, also teachers, because some of these children spend more time with their teachers than with their parents. So there are a few things that you need to know. So first aid when it comes to having a seizure. Please do not put a shoe over the patient.
No pens in the mouth, please.
No pens, no spoons in the mouth. So all you're supposed to do is just make them lie on their side, on preferably the left side, and just don't restrain them. Just hold them down, move them away from anything that can harm them, just, and if you can rush them to the health facility if you notice that the seizure is prolonged, because as she explained, like a seizure can cause damage to the brain. So if you notice that this person is not coming out of that seizure, then you take them to the hospital. Please don't put spoons, don't put cooking sticks in the mouth. Those are harmful. They can break the patient's teeth. They may end up, the teeth can end up lodging in the throat and all that. They can bite you, all those things. Yeah.
Also, just loosen the tight clothing like bra and back of the bras, the buttons, like for the, say, trousers, belt, tie, loosen them up. It helps a lot. And then just move them, like she said, just move them out of danger, out of tables, chairs, and so on. And then put them on their left side. Don't forget to, you can support their head or put something
cushion,
like a pillow, like cushion, in case they bang their head when they're having a seizure. And then that's all you need to do. Don't restrain. Don't hold them down, please, because they are very strong. No, not they are very strong. We are very strong. You can even break someone's hand because, like, I think my mom once held my hand when I was convulsing. Like, I think she was trying to calm me down, probably. Like, calm down, or something. And then I held onto her hand and I squeezed it more. And I think if I took longer season, maybe I would have given her some fracture. Because she complained that day, no, after you held my hand, it's paining, Yeah, one of her fingers even like swelled up a little.
Oh.
Yeah. So don't do that. Don't make a mistake. Make no mistake by putting anything in their mouth. When they bite you, they will not let go. Yeah, because the muscles, everything is like contracting. It's in a state of contraction. So, and they only relax when the seizure is done.
Yeah.
So don't do that because you'll also be putting yourself in danger.
Yeah. And by the way, everyone is entitled to having one seizure in their life. And yeah, so not everyone who has a seizure has epilepsy. So different things can cause seizures. If your blood sugar is low, if your electrolytes are imbalanced, if you have a fever, all those can cause you to have a seizure. So not every seizure is equal to epilepsy.
Yeah.
Yeah.
That's right. Epilepsy, people who are epileptic have seizures, but not all seizures are epileptic. Yeah.
Exactly what she said.
Yeah.
Yeah. So any last words for our viewers and listeners?
I think I've said everything. Well, I've not said this. I'm really glad to be doing this, like to be on this podcast. Advocacy gives me life. Like I thrive in it. Like for some reason, talking about it it makes me stronger and makes me be able to support people living with epilepsy out there. That's why I'm an advocate, because I really enjoy doing it. It's a passion of mine. I think one of the great passions that I have in my life. Yeah. Purple is the color.
Oh.
Yeah.
Yeah.
Yeah. So I love purple just for that fact. My favorite color is blue, but I love purple just for the fact that it's the color for epilepsy. Yeah.
That's interesting. I actually didn't notice that purple is the color, but now I know.
Now you know.
Yeah.
No, I'm glad.
It's good to know. So thank you so much for joining us. We hope to have you soon.
Well, I'll come again.
Yeah.
Probably. I don't know, either for this or something else.
Maybe for this or for something to do with physio.
Yeah.
We'll definitely have you back. So this was Health with Dr. Yvette Masaka. Thank you for joining us, and don't forget to subscribe. The more you subscribe, the more guests we have. Yeah. Bye.